Hello everyone, my name is Liang and I am from Group 8. Today we are going to discuss about what is Dissociative Identity Disorder (DID), clinical features of DID in DSM-5, causes and treatment for DID. According to World Health Organization, almost 20% of children and adolescents around the world have mental health issues. A survey done by Ministry of Health of Malaysia, National Health and Mobility Survey show that 30% of Malaysians have mental health issues. DID, or also known as multiple personality disorder, is not as common as other mental health illnesses. The estimated percentage of patients with DID is only 5% among the inpatient psychiatric population, 2% to 3% of outpatient psychiatric population, and only 1% of the general population around the globe has DID. In Malaysia, only 3% of the psychiatric hospital patients have DID. When we talk about DID, we should know that every identity that appears in the person with DID has a different history, self-image, and name. The identity that is most frequently encountered and uses the real name of the person is known as host identity, while the outer identity is varied from the host identity in the perspective of gender, age, and language spoken.
Now we are going to proceed to the criteria of dissociative identity disorder. What are the symptoms or diagnoses that distinguish between this disorder and other dissociative disorder? Let us find out. The first one is disruption of identity characterized by two or more distinct personality states. Here we can describe it as having different people share the same body. It is because all the personality have their own identity and it can differ from many aspects like personal history, self-image, name, gender, and age. The patient might be aware of the disruption of personality themselves or being told by others. The second criteria is recurrent gaps in the recall of everyday events, important personal information, and traumatic events that are inconsistent with the ordinary forgetting. It happens when there are changes of alter in the body. To make it simple, when the other personality takes over the body, it will not remember everything that happened previously when the other personality took over. That is why there is a gap in recalling everyday events. Next, the third symptom or criteria is having significant distress or impairment in social, occupational, or other important areas of functioning. Next, the disturbance is not a normal part of the broadly accepted cultural or religious practice. As noted in DSM-5, many cultures around the world experience being possessed as a normal part of a spiritual practice and are not dissociative disorder. The patient culture background plays an important role in the diagnosis of DID. The last one is the symptoms are not attributable to the physiological effect of a substance or other medical conditions. The symptoms happen when the person is not under the influence of any substance like drug or alcohol intoxication or any medical condition like complex partial seizure. Now I'm going to pass to the next presenter and we are going to learn about the causal factor of DID.
Thank you, Najwa, for the explanations. Now, I'm Sarah. I'm going to explain about what are the things that influence DID. First of all, DID can occur due to the traumatic life events or overwhelming experience. According to post-traumatic theory, a person will develop the DID as a coping mechanism for them to cope with the problem. For example, a person cannot cope with the emotion they get from the overwhelming experience. So they tend to have the DID as their protective mechanism so that they can feel more safer, such as the protective personality. However, the DID usually develop on people who are easily hypnotizable. Next, the ongoing abuse or have experience with abuse. For example, the childhood abuse which can lead to trauma. So when it can lead to trauma, the same process will happen as I mentioned previously. As we know, childhood is a phase where a children was in process in developing their emotions. So when there is an abuse occur, it will create a negativity inside their emotion. So due to this, the children might be into their fantasy or a self-hypnosis, which can lead to developing a personality or DID. Lastly, a therapy induced. According to socio-cognitive theory, a person develops a new DID unconsciously or consciously to learn and adopt the new personality as a result of improper therapeutic technique by the therapist. For example, in the hypnosis session, the patient will suddenly remember that he or she is being abused, but the fact is the situation is not really occur in the reality. So due to this, a person might develop a protective personality, for example, so that he can endure the pain. So if the therapist is unaware about this false memory and continue the session, so this can be an encouragement for the person to adopt that personality. That's all from me. I'll pass to the next presenter.
Now I'm Farah Farisha. I will explain about the treatment of DID. Surely everyone wants to know the treatment method commonly used in DID. So this mark is treatment. There are three types of treatment commonly used in DID. The first one is psychotherapy. One of them is cognitive behavioral therapy, which is CBT. It is used to help patients explore and control the stressful situation or impulsive behavior. In this therapy, the individual with DID identifies irrational belief, and the therapist will encourage the client to engage in the activity that will help them to improve their declining self-belief. Next is family therapy. Family therapy assisted the parents in understanding why their child was dissociating and how change in the family dynamic helped their child development of coherent and integrated personality. Therefore, parents will be more alert and aware to the symptom their child is experiencing and will know how to deal with the disorder. Another treatment is pharmacotherapy. There is no specific medication to treat DID. However, medication can use for those associated with anxiety, depression, and so on. The first one is antidepressant medication. This medication is often used to relieve depressive or post-traumatic stress disorder (PTSD) symptoms. Other than that is antipsychotic medication. Overactivation, thinking disorganization, intrusive PTSD symptoms, chronic anxiety, insomnia, or irritability have all been successfully treated with antipsychotic medication in relatively low doses with DID. The next treatment is hypnosis technique. Hypnosis is most often used for relaxing, healing, conditioning, and ego strengthening. Hypnosis can help a person with DID gain more knowledge about their symptom, identity state, allowing them to have more control over those states as they change from one personality state to the next. That's all from me. Now I will pass to the next presenter.
Mental illnesses that are less common like DID is not emphasized, so sometimes people may neglect the symptoms and do not receive proper treatment. People with DID usually will develop an average of 13 to 15 personalities. DID does not really affect the daily function of a person. Patients with DID can still manage themselves well, such as taking good care of their personal hygiene, feeding, and doing physical activities. However, public stigma towards mental health issues may cause them to isolate patients with DID. They may think that patient with DID is weird. Thus, patients with DID may not have enough social interactions with others. In conclusion, based on research, media false portrayal of mental illnesses will enhance public stigma towards people with mental health issues. As Malaysia does not emphasize mental health, there are no enough support systems. Therefore, it is important for media and government to work together and build a society which is more supportive and caring. That's all from us. Thank you.